Hi, everyone. If folks don't mind, just want to ask for we do have some call-in users. If you wouldn't mind just unmuting and letting us know who you are, we do want to take attendance.
Nay, it's Karen Howard.
Oh, hi, Karen. Okay, so you're on the phone in one square and on your camera.
I don't have audio on my.
No worries. We're good. Should we get started, team? I think we've got a fair amount of folks on. We want to welcome everyone to the first PCP large group PCP reward plan / provider engagement report training. I'm Renee Sutton from AHP. My teammate Jana Darlington, our PR liaison, Kevin Kelly and Elizabeth Sharp from our optimization team, and of course Christy Howd, our director of IT. So we're here to provide an overview of both the PCP reward plan, the 2022 PCP reward plan, and the provider engagement report, which is the tool that providers will be able to use to manage their performance under the plan. I've got a couple of slides to share, and if folks don't mind, I'm just going to keep it in just the regular view instead of slideshow view. It's a little easier to manage with the number of screens that I have going. So let me just share my screen really quickly here. Bear with me. Okay, hopefully everyone can see that all right. Look good, team? You see it okay? All right, great. So again, thank you everyone for joining in here. I do want to just clarify that this training isn't going to be one and done. We want to walk you through the reward plan. We want to walk you through the tool. This session is being recorded and it'll be uploaded. So anything that you missed, you'd like to recover, you're going to have the opportunity to view it. But we hope to be able to support you in the coming weeks and months as you're using the tool and as the tool is changing to make sure that you're getting the most out of it. So, we were just hearing as we've been engaging with practices about the reward plan and the PER, just hearing a little anxiety about, what it means or some worries about some additional, burden on your part to utilize this tool. And we hope that over the course of this training today, you'll feel a little, reassured. We did start the process of reaching out to you for doing the guest account process. And as we stated in those emails, we are just identifying the folks from your practice whom we think at the early stage here would be the best ones to implement and give access to the PER. So I just want to be clear that you're welcome to any provider in the office that is on contract and currently has data that you see in Arcadia. We would want to be able to implement to the PER, but it isn't our expectation that every provider in the practice has to log in, has to be implemented, has to be trained. So I think that might have been the source of just some of that anxiety about it. And I just want to reassure you that's not the case. We're getting started with a smaller cohort of users just to see how it goes. But certainly practices that wish to implement everyone at the go or at the first go can. So with that, let me start talking about the 2022 PCP reward plan. Many of you have heard a lot about this already. This was effective for the 2022 performance year, and the purpose of our changing the reward plan from its prior iteration was to just better align it with the way we as a network earn gain sharing to begin with. And anyone who's seen my little gain sharing slide, it's both cost and quality. We can do as well, we can do complete gangbusters on our quality and measures. But if we do not beat the budget, if we do not control the spend, there will be no gain sharing to share. So this is a way of adding to the incentive plan some visibility into how your behaviors drive costs. So that is one of the reasons why the PCP reward plan was to add that component of cost performance into the incentive plan, which to date has really just centered around, prior to this, just centered around your performance to those quality measures in the Arcadia dashboard. Under this new plan as well, Gina, can you keep an eye on the, thank you. Also under this new plan, we are going to be mingling the two sources of funds that make up the dollars that we pay out to you. We used to have a quality incentive payment that was paid out in around the March timeframe, and then we would do gain sharing in the August, September. Now we're going to combine those funds. The quality, the pool of dollars that used to make up that quality incentive will now they'll be pooled with gain sharing funds to make for one PCP reward plan payment that'll be paid out in August, September of the year following the performance year, just the way gain sharing always has been. Okay. So how this reward plan has been designed is, as I mentioned, we're adding the cost savings initiatives piece. So while the quality program is still the biggest component, 60% of the incentive will be based on performance to the quality measures and depression screening and follow-up, with within that bucket, quality measures being the 50%, depression screening and follow-up 10%. Cost savings initiatives will be 30%. LARC is one of those and pharmacy is the other. And you'll see the title of the slide is family medicine, because this looks a little different for pediatrics, in that pharmacy wouldn't likely be an opportunity. And I'll show you that in a minute. Citizenship is 10%. So those cost savings initiatives, LARC and pharmacy, LARC is going to be that the provider took a reproductive health counseling class sometime in the prior 2 years. And the pharmacy piece, and this is something new, and there'll be more time to go over this in the future, and we'll be sharing more information about it. But as this might be new to you, the pharmacy reward is going to be based on 4 medication initiatives: insulin, Lispro, long-acting insulin, metformin, and NSAIDs. A provider baseline is going to be established, and based on your performance to that baseline, you will earn an incentive, and we will go into that in more detail later. We got someone in the waiting room, Jana. So as I mentioned, we have a slightly different look. So family medicine is based 60% quality measures, 30% cost savings. Citizenship is 10%. Now, under if you're an internal medicine provider, LARC is not likely to be an opportunity for you. So for internal medicine, providers are going to earn 75% for their performance in the quality program component, and only 15% for cost savings initiatives, and that'll be that pharmacy piece. And then citizenship is 10%, regardless of specialty. And then pediatrics, just like internal medicine, has a different mix, because pharmacy wouldn't be an opportunity for them, but LARC would be. So those extra points are allocated to or extra percentages are allocated up to the quality program. Citizenship is 10% for everyone. And we have talked about citizenship a little bit. We'll be taking a look at first at a practice level. Did the providers earn the citizenship component? If the practice does certain activities, like their practice manager comes to meetings, or they are involved in a quality initiative or piloting a quality initiative, then every provider in the practice would earn that 10% component. If the practice isn't doing those activities, then we'll be looking at the provider level, at the individual provider. Did that individual provider do the things necessary to earn the citizenship component, which are things like, do you accept our emails, or have you unsubscribed? If you've unsubscribed, you're not going to check that box for the citizenship component. Do you participate in the PCP advisory committees? That'll earn you a checkbox in the citizenship component. And I believe I just covered all of that. Okay, so I want to stop there and ask if there are any questions. That was a very quick overview of the reward plan. And I don't want to take up all the time on that and want to leave more time for my colleagues to review the actual provider engagement report tool. But that said, any questions? Okay, Christy, I think you're ready to take it away.
All right, here, let me share my screen. So I'm going to do a demo via PowerPoint because this dashboard includes provider practice specific data as well as patient PHI data. So I've blinded this so that we can talk in general terms, and often it's just easier to navigate through a PowerPoint. So first and foremost, we've tried to make this a very intuitive, easy to use tool. So it's not a burden on you or your providers to log in to the dashboard. Wanted to first make it easy for you to remember where to go to log in. And so go to the HP website. In the upper right-hand corner, there's a green call to action button right next door to the Arcadia login. And if you click on that, it's going to take you to a detail page. We recommend launching the provider engagement report from the website because this page is going to be where we're going to post updates. If the dashboard's going to be down for any period of time for quarterly maintenance, if there's any unexpected issues, things like that are going to be posted here instead of going out via email to everybody. The other thing is there's some links to quick reference guides, release notes, and then the button right here launches you into the provider engagement report. There is nothing stopping you from bookmarking this page and going quickly to it. If you do, but you notice a problem, you can't get logged in or whatever, we recommend that you come back to the HP website, come to this page, see if there's anything that's posted there about the system downtime, and or reach out to us for support via this mechanism. Just to give you an idea, quick reference guide. So the very top link here, the per quick reference guide is a 2-page PDF. There's not a big user manual and set of instructions to teach you how to use the dashboard. We wanted this to be intuitive. All this is doing is highlighting out things that I'm going to be showing through this quick demo. Things that aren't necessarily intuitive, but that you'll quickly remember once you've used it once or twice. Things like being able to toggle between a practice and an individual view. How do I open up the filtering screens? How do I click into more details? If there's hover help in different places. And just as you get used to working with dashboards, these things will become easy to remember. What's not intuitive, and you might not do as frequently, is downloading data like patient lists into an Excel spreadsheet, or downloading a page in the dashboard down to a PDF or a PowerPoint page so you could share and present or report to others. So page 2 of the quick reference guide is probably something people will refer to a little bit more frequently. I'll give a quick demo of what it looks like to download things, but there is a little download button in the upper right-hand corner. PDF is pretty intuitive, how to get something out to a PDF page. What's not intuitive is how to get it out to Excel. And there you have to select this cross-tab feature. Cross-tab and Excel aren't necessarily something that's easy to remember. So that's primarily what we wanted to call out. The other thing about downloading is that you can download every single little component, and you really only want to download the patient list. So we're trying to name it consistently so you can find it. So that's why this quick reference guide is important, just as a place to go back to when you want to do this particular activity. The other thing, there is a guest account FAQ. So if you are starting to set up your accounts or need to go back and add an account for a new provider in your practice, this document will be out there at all times. So you can refer to that. And then the other thing that we will be maintaining is we will be periodically updating the dashboard. And there, every time we update it, we will post a new version of the release notes. Major updates, adding major functionality, resolving big problems, whatever we will likely announce in a network news or through other methods. But for most things, they're minor changes, changing labels, changing the way calculations work, things like that. So we're going to maintain the release notes, the newest versions always at the top. There's a version number. I'll show you where in the dashboard you see what version we're on. And then the date was the date of the release. So if you're noticing something that changed a little bit since you last logged in and you're questioning what is happening, you may want to refer to the release notes. So logging in, back to the dashboard here, when you click this View Provider Engagement Report button, it's going to launch you to a login page. You need to have your University of Rochester's login account because we are hosting the dashboard on their servers in the network in order to protect PHI. What we do not do is share this dashboard and your information with everybody in URMC. This is your private information. It is controlled and secured with your user account. And what you have designated during the setup of your account is to the level of access that is appropriate to you. And I'll explain some of the security as we go through the dashboards themselves. But here you got to put in your username, your password. The guest account process will take you through the multiple steps of setting up the account and confirming your identity. The very first time you log in, domain is blank. You need to select URMC Active Directory, not U of R, because we are on the medical center servers in order to protect the PHI. It will remember this after the first time on whatever device you're logging in, but you will need to refer back to this occasionally. Sign in, and then you're going to get prompted to confirm that you are who you say you are. And so this is the Duo setup, which is also part of the account setup, where you decide, do you want a phone call? Do you want to push to an app on your device? And how do you want to acknowledge that you are who is logging in? I like the push. So it sends me a little push on my phone. I confirm on my iPhone, and it lets me pass right through the credentialing. Once you're in, this is the dashboard that's presented. And so I'm showing you up here version 1.8. This is not in production yet. We're in final testing on it. It should be released in the next few weeks. So I want to show you this functionality that you're going to be seeing. When you log in, your name, your practice name will be listed up here. I'm going to be going through as myself. There are the little 3 lines which will click down into some filtering I'll show you shortly. The little double arrows, which is drill down. Again, these were all on the quick reference document. But the dashboard here is showing you all the key components of the reward plan, the things that are most important for you to see at a high level. If you're a provider with only access to your own data, that's where you're logging in. That's what you're seeing is your own information. If you are a practice manager and you're logging in for your practice, you're logging in at a higher level, and so you have the ability to drill down to more specific data. And so, like for instance, provider rewards, because I'm logging in as a super user, I'm saying it's rewards are only shown at a provider level, which is prompting me to log in or filter down to the particular provider that I want to see how they're doing on their reward. Cost versus quality. This one says it's calculated at a practice level. So I need to filter down to a practice level in order to see some actual information here. Quality measure performance is going to be reflecting the percent of points earned from Arcadia. We are in the midst of validating the data and the quality performance post our upgrade. And so we don't have anything to show right now. It's going to be super high level. It's not going to reproduce the drill down capabilities of the quality measures, patient lists, gap lists, things like that. We are not looking to reproduce the Arcadia functionality here. For 2022, it's only going to be showing how the provider that you're looking at is performing overall based upon whether they're which quality measures apply to them. In the future, we might do a little bit more trending and some other things here that add value above and beyond what we can do in Arcadia, but it's going to be very basic and simple when you first see this. Citizenship, because I'm logged in at the highest level, it is not showing me anything. This is more than one practice has been selected or more than one provider selected. I'll drill down quickly in a minute. Depression screening is showing at the highest level, and this is all dummy data or old data, just to give you an illustration. So total patient population that qualifies for the initiative, how many have been screened, what was our target for screening this year, and then we see a donut here and the percentage screened. We're using some colors also is to highlight out where you're doing well and where you might want to drill in a little more. Anything that's blue is something you may want to drill into. You have opportunities for improvement. If it's green, you're hitting the targets, and you can just pay attention to the ones where you need to focus. Pharmacy cost, this will be going through a little bit of change. I didn't take the newest version. The information is a little bit confusing, but overall with the pharmacy initiatives right now in 2022, there's 4 drug classes. We're going to be showing you how you're performing in each drug class compared to the network as a whole, and how money and how you're doing on earning the reward for that particular drug class. And so I'll go a little bit more into that when I get into pharmacy. And then LARC, pediatric LARC, this is only going to be turned on for family medicine and pediatric practices that have an opportunity to earn the LARC. And so this is one where you got to drill down to a provider level to see whether you've met that criteria. So to show you what it looks like when we do, I filtered down here to a specific provider and blinded the data a little bit here. So you can see their total percent rewards earned is 44% out of 100%. I'll go a little deeper in here in a moment. Cost versus quality. This is at a practice level. So for their practice per member per month cost is 79.35. And how many quality points have they captured at a practice level is 79%. I'm going to click in there in a moment. Citizenship is one where you start to see now, because I went down to the provider, how are they earning citizenship? There's a practice level component, which they have not earned. That's blue. Provider level, they did earn it as an individual provider, earning that citizenship, because that's the green part. I'll drill there in a moment. For that provider, they have 894 patients, 223 are screened. Their target for this year is 534. So they've got some work to do here and some opportunity in pharmacy costs. And then the pediatric LARC, because we are down to a provider level now, the wording here might change a little bit, or it will change a little bit, but really this year we're looking at has this provider participated in the training that's offered later this fall. And this one is turned off because the training has not happened yet. And as soon as it is, it'll be a big green check mark that has been completed and that percentage of the reward has been earned. So I want to drill into provider rewards quickly. And again, this is some test data and an illustration of what it's going to look like. If you're going in as a practice manager or at a higher system level, you can see which practice name. If you have multiple offices or practice locations, you can see it broken down by practice location. But more specifically, you're going to see by provider How are they doing with the potential reward earnings? And because the dollar amount isn't known, as we're presenting this data, we can only show you out of 100%, how are you doing on your potential earnings? And we want to get you as close to 100% as possible. And so this is a really great page, and also that it allows you the ability on the right-hand side to filter by a component. So you can look at how people are doing overall. Are they earning the maximum reward for all of the efforts that they're doing? Or if you wanted to focus in on, say, depression screening, you could just filter on depression screening and see how your providers are doing individually in that particular initiative. If you're logging in as an individual provider with only access to your own information, you're just going to see one set of data here for yourself. You don't see it at a higher level. You can filter by initiative, but you're going to be limited to what you're allowed to see. We've got more components to add. Again, this is dummy data, really early screenshot. We intend to show you what is your reward plan. So there may be, you know, your practice as a whole is prescribing in all of the drug classes in the pharmacy initiatives, but you may have an APP or a provider that doesn't prescribe in that pharmacy drug class. And if that happens, then their reward plan would not include the pharmacy component, and we reallocate the percentages in quality. So you would see then the percentages changing, and that's how it might be different provider by provider in your practice. So the reward plan is important. That's your starting point. How much you've earned based upon the data. And then what's your opportunity? How much more could you potentially earn? And then you can filter this out. You can download it into Excel, and you can figure out where you want to target. Go back to the home page and look at cost quality here. We want to do, and if you remember, I said this was at the practice level. This data in the bottom left-hand corner, we've provided the data source. This is a little bit old, out of date. We're waiting to get total cost of care report from Excelis for 2022. And we haven't received that yet. So we're a little out of date with that. The quality measure snapshots, however, those are pulled every month at the beginning of the month, the first Monday of every month. So that we should be able to see updated on a more regular basis. The focus here is to take a look and see how are we doing with costs overall. This is not a specific measurement in the reward plan. It's to look at how you're doing overall and see if there are opportunities or where we may want to focus efforts to help us perform better and maximize our gain sharing. So if you look at the top chart, it's the pharmacy per member per month costs, and it's only from Excel data. The green line is your practice. The black line is the network as a whole. It's based on your peers, practice peers. So internal medicine is compared to only internal medicine practices. Pediatrics are compared to pediatric practices only, and family med are with family medicine. The medical PMPM is the same type of a graph, just to show trending over time. And then the bottom chart here is to show how you're doing in comparing to peers with both quality and cost. And so quality is broken down into our 3 tiers: bronze, silver, gold. This is reflecting our normal targets. 65 and below was bronze, 95 to 65 was silver, and at 95 and above was gold. This has not been adjusted for the COVID adjustments that we did on quality performance. We're hoping we get back to the normal targets this year. The diamond, the black diamond here, if we hovered over it, it would have your practice name. It would say, this is where you as a practice are performing in quality overall, but also in comparison to the PMPM total. And so the average PMPM here is, I think, 83.85 amongst like practices. And this particular practice is right just below, just slightly below at $79. But they're also performing in silver. So you can see there's a few practices that are doing a little better. There's a lot of practices that are struggling with quality. Some have higher PMPM. We want you to be moving into the lower right-hand corner, improving quality and lowering costs. So it's just a way for you to get an eyeball on how you are looking compared to others. The real meat of the reward plan starts in quality, which is Arcadia, and it doesn't change. With the quality measures you're being held accountable for and the points earned and all of the targets and such, that's staying very consistent. I'm going to drill into citizenship here. This is showing practice level 1 out of 5 criteria has been achieved, but you're not achieving citizenship as a whole. And then provider level 3 out of 5 has been achieved. So if we drill in using the double arrows, we can see what has actually been done for this provider. So they get that 10% citizenship, but they earned it on their own because of the practice. The practice manager has attended 2 meetings, but we don't have a practice champion, not engaged in pharmacy, and some of these. This is dummy data, and we're working on getting the practice level data loaded up. Providers can earn it themselves, even if their practice hasn't earned that criteria. So did the provider attend grand rounds, the clinical grand rounds? Are they opted in to receive our emails, our network news and other emails? Are they accepting new patients at the end of the year when we're calculating out this citizenship component? Are they on a committee board? Or are they the designated practice champion? And so you can see you get green check marks, and we just count up. You have to achieve 2 out of the 5. And if you do, you earn the total 10%. Coming back to the home page, we'll dive into depression screening. So depression screening is a little bit more complicated of a screen, a lot more details here. I'm not going to go into describing the initiative, just a little bit more about the component and the details and the data itself. We are still working on validating that we get the data feeding from your EMR into Arcadia correctly. V6 upgrade did fix a number of issues. We still have some others that are remaining. And this dashboard, though, is updated every week. You'll see in the upper right-hand corner the date that was last refreshed from the data that we're pulling into Arcadia. So as we're doing data validation and cleaning things up and improving mappings, you're going to see it happening and reflected here real time, or near real time, weekly. As a whole, we're drilling down deeper and deeper into the initiative. The patient panel, how many patients do you have on your panel? This is an entire practice or entire system. If it's a provider drilling in here, they would see only their own 800 or so patients counted. The green is how many have been screened. The blue are the opportunity. They haven't been screened, but they also haven't been into the practice for their annual visit or a preventative type visit. And then the teal here is that there was no screening done, but they've already been into the practice for that preventative type visit. So this might have been lost opportunity. Will we be able to get them back in to do a screening or not? We'd like to see this get smaller and smaller every year. There's a key at the bottom of every chart. If we drill in now into the screened patients, these are the 9,374 that were shown in the bar above. Of those, how many are at risk or how many are positive? So at risk is defined as 5 to 9, positive is 10 and above. And then for those, the bottom bar is for those that are positive, how many have had their follow-ups and that we've captured in the data. What I love about this is that this is actually can become actionable data, and you can download patient charts. We don't show them initially to just because of performance and to hide PHI. But if you click in on any one of these areas, they say we wanted to see who are the at-risk patients, or do we want to see who has no screening but no annual checkup? This right-hand side will become a patient list. So I'm going to pretend to do one of those. Oh my goodness. I guess I didn't. I think I overwrote that that page on my presentation. But anyways, what you'll see over here when you click into one of those is the name of the patient, who is their provider, what is the date of their last visit, last screening, and what is their next appointment if there is one. And that's a patient list that you can export out. So that list will change depending upon which section of the grid you click on and open it, and then you can download that one. The other thing to note here is that there's some hover help, and I just wanted to show you what it sort of looks like. So if you hover over any of these bars, you can see how many are your attributed patients. What is that baseline number, that lightly colored dots, and your target this year? What's the actual number? Anything that's an I is more information. You hover over that, gives you a little bit more definition around that particular section of the component. And then the other thing here is in the right underneath the update, the title bar, there's this review. I want to show it to you at a bigger screen. This review the depression screening and follow-up initiative. If that initiative has more information, you'll find this link in the upper right-hand corner of these pages. Depression screening, when you drill into it there, this talks about the initiative, the program description, who are the key staff at AHP, links to resources on our website. And this is depends upon which components you're in, and the content of it can provide you more information. We're trying to put things here that make it easy for you to recall what you're working on, why, getting more information, finding out who to contact, and not have to go looking in multiple different places. Back to the home page, I'm going to drill into pharmacy. Pharmacy will have some changes. This one right now is showing overall in pharmacy, the network average of people utilizing the less costly medication is 95%. This particular practice is at about 87%. It's blue. We can drill in and do something maybe a little bit more with this particular practice. I'm clicked in here. This is an example of the details you would see by drug class. How, if it's green, you're performing optimally, you're beating network average in that network, in that class. And so you would be receiving 100% of the points, 100% of the reward available for this drug class. We need to show baselines and targets on here. Those lines aren't on here yet, nor how you're performing. That will be the next ad that you'll see. Long-acting insulin. This is blue. This is an area that there is room for improvement. It's performing less than the network average. Same thing with metformin. And just like the depression screening, if you clicked on any one of these bars, the patient list below it would change. And unfortunately, I didn't mask this. These are old patients from some particular providers. The medication here is some old data. The last fill was June, February. These may have been switched since then, but we are able to download this patient list so that you can then determine whether or not these particular patients are eligible for switching. Pharmacy knows that not always are these patients eligible to switch for various reasons. If you've reviewed their charts and you can't switch them to the less costly one, they offer you the opportunity to do a patient chart review. And then we would exclude them as being reviewed, not able to be switched. And then those get removed from your performance. And they don't count against you. We're trying to impact those that are impactable. And we're also only looking back at the last 4 months of pharmacy fills so that those that have already switched aren't counting against you as well. This is an example of downloading. So say we want to download a particular patient list around a pharmacy, a drug class that we may be able to do some switching on. If you go into the upper right-hand corner, there's a little download icon. When you click on that, it opens up the options of what you want to download. And we're going to choose cross tab because we want it to download out into Excel. And then it opens a little pop-up menu here of all the different pieces of this dashboard page that you could download. What we care about is the patient list. We don't need all of the rest of the stuff. So you scroll all the way to the right, find the patient list, and then we can just click and download to Excel. It comes open into your downloads folder. You can then open it up and it has everything that you've seen on your screen in an Excel functional format. And then last but not least, the pediatric LARC. Like I mentioned, the drill down here will be more along the lines of the HELP initiative, just saying that what you need to do this year is attend a training. The training potential dates that are available or a link to those resources will be on that page. And then as soon as that we have the attendance loaded, this would be marked as check complete, and you would see that reflected in your rewards. So that's the end of the quick drive through the dashboard. Wondering if you have any questions. All right.
Christy, I guess I did have one question, just the depression screening. I know you said you guys have been validating data, but is it clear that it is pulling the score from all the places it needs to, and the follow-up question boxes?
We're validating practice by practice, EMR by EMR, and I'm not sure if we've resolved the issues that we have with your practices data. I know we were doing a lot of troubleshooting there, so that we would have to pull Willie and Elizabeth in to confirm whether or not we're seeing what we expect right now. As a whole, we know we've seen overall much improvement. A lot of the individualized tickets have been resolved and validated, but there's still some one-offs that we've still chasing and trying to get addressed.
And then you would just follow up with the practices to let them know.
Yep.
Okay.
Yep.
Thank you.
All right.
Any other questions or comments? Okay. For those of you that have already completed the guest account process and they're all set and have your credentials, we invite you to please log into the PER and play and reach out and let us know what questions or concerns you have. We will be following up with this, with everyone invited to these trainings to let you know where you can access the recording of this session. We'll also be reaching out soon with some news about the status of the reward plan. It's not going to change your access to the PER. It's not going to change what you're seeing there today, but we are going to be letting folks know about where we stand on the topic of your accountability relative to 2022 quality performance. So that'll be, you can look for that in the coming week or so. But for right now, if you have your access, we hope you'll log in. If you don't have your access, I encourage you to please return the guest account spreadsheet that was sent to your practice either by myself or by Jana. and get those back to us so we can get your user guest accounts all set up. We appreciate your process, or I'm sorry, your patience during that onerous process. There is a lot of steps to it, and we've tried to lay those out as clearly as we can in our communications to you, but we do understand that there can be a little back and forth about getting those guest accounts finalized, and we appreciate your help and your responsiveness to that process. And Cherie Turpin, who's not on the call, is kind of our lead on that, and we'll be shepherding you through that process once we've received your guest account spreadsheet back. Anything else, team, that we should cover before we let our audience go for this session?
There is a question. Karina asked, when is this officially launching? And it is officially launched. It is in production, is up and running. It's not, doesn't include the reward piece that I demonstrated. That's coming. The citizenship piece is also coming. It does have depression screening and the pharmacy, as I demoed right now. But the new pieces that we're adding in are in validation and testing right now. I expect if everything stays on course, we should be pushing that version 1.8 into production in the next couple of weeks.
Thanks, Christy. And Dr. Bennett noted to me that his question about citizenship was answered, and when Christy touched on that. So we'll leave that. Anything else? If not, we thank you for your time. I ask if the AHP team can stay on the call for just a minute.